There were maintenance issues this morning with the train at DIA, and that left many people waiting for the train this morning. A traveler named Marty shared these photos with us on Twitter. Train delays left people waiting in a large crowd without social distancing. So we called DIA about the situation. They say the delay was minor, about 20 minutes. They say if the situation would have been worse, team members would have assisted passengers on the train platform and remind them to physically distance and wear their masks. In long-term outages, the airport is prepared to transport passengers on buses. Speaking of masks and social distancing, well, there's science and then there's opinion as well. We found ourselves in a situation where many people are uncomfortable because people aren't following the rules or can't. So what do you do? Nine Health expert Dr. Payal Kohli is with us now with some advice on that. Obviously today, with Governor Polis issuing the statewide order that goes into effect tonight, what do we do if we find ourselves in a situation where people aren't socially distancing or wearing a mask? And I guess I should make sure to preface this with scientifically, what should we do? I don't want to ask you a political or a question about propriety.
You know, Tom, this is a situation that's not all that uncommon. In fact, I found myself in this situation just a couple of days ago where I was sitting in a waiting room. It was very small. It was difficult to socially distance. And there was a woman talking loudly on the telephone without a mask. And there was another woman eating. And of course, I think about droplets all day long, as you know.
Yes.
So all I could think was all the droplets that they're spreading around that I am then inhaling. So I think the science tells us that if somebody's not wearing a mask, you're in a small closed space with them, your risk of infection is exceedingly high, and it's directly related to the duration of contact. So the easiest thing to do, honestly, is to remove yourself from the situation if you feel uncomfortable, particularly if you're one of those high-risk groups who's very susceptible. But if that's not possible, for example, I've heard stories on airplanes where people take off their masks or just not wearing masks altogether, then I would recommend approaching a figure of authority like a flight attendant or somebody else to encourage that person to wear a mask, because you know the science is pretty unequivocal on how masks reduce the spread. But it's important for us to do something, because if we don't, these types of situations like that picture we just saw at DIA could very easily turn into super spreader events if even one person there is sick and not complying.
And that seems to be one of the problems. We're asking people who have plenty to do with their regular jobs, flight attendants, people who work in stores or restaurants, to help legislate this, and it is an uncomfortable situation. So let's go back to DIA. Everyone's crowded around there. That's out of everyone's control. But we've all been in situations where people just aren't socially distancing. Have you seen data about people who are more or less likely to socially distance? Are there predictors that they might even help you decide who to hang with?
There are, Tom, and I was a little surprised to actually see the data. So this is a study that came out of University of Copenhagen, and it looked at about 1,500 Americans who filled out a survey, and it asked a number of different demographic factors. And what you see here is essentially what's called a forest plot. So that line is the line of unity. That means there's no difference. If you're on the right side of that line, that means you're more likely to do the social distancing or for a longer duration. If you're on the left side of the line, that means you're less likely to do so. The left-hand column says about social distancing, and then the right-hand column says about the duration of social distancing measured in months. How likely are you to maintain that? And you can see that, you know, female gender has a little bit of an effect. So women generally follow the rules better than men. So women are more likely to socially distance, but less likely to maintain it for longer. In terms of race, you can see that Black people, even though they're more susceptible to the virus and its effects, are actually less likely to socially distance as compared to Asians, which appear to be the highest group. Education didn't seem to have much of an effect, but what really surprises me was the bottom half of that graph, which is where you see that people's television behaviors, how they consume media, and how much the pandemic has affected them are actually the biggest predictors. So those people who had suffered loss of business as a result of the pandemic are most likely to socially distance and most likely to maintain it for longest. So what we're seeing here is not so much who we are, but how we were affected by the pandemic and how we get information about the pandemic that appears to influence our behaviors.
Well, it always interests me because you love the social science of this, things like that, where you're studying what people do. And I guess in the long run, the hope is that in 100 years and in 1,000 years, that the lab rats we are right now going through this will help people going forward.
That's exactly the hope. And just like we've learned from the mistakes of the Spanish flu and, other pandemics and what went wrong, we're hoping that we're going to leave a good legacy for those ahead of us. But I think it's important to look at the science, it's important to look at the data, and it's important to reflect on our behavior and continue to adapt and evolve as our challenges change with this virus.
Adapt, evolve, and hopefully improve. All right, Dr. Payal Kohli, thanks as always.